Impact of COVID on healthcare sector. With the outbreak of COVID-19 in India and stipulated lockdown, the private healthcare sector is witnessing an unprecedented slowdown as per EVA-IFIXI study titled COVID-19 Impact Assessment for Private Healthcare Sector and Key Financial Measures Recommendations for the Sector. The study is based on an assessment of private healthcare players in the country to assess the economic impact of the COVID-19 pandemic and provides recommendations on the fiscal stimulus measures it needs in the coming months. Impact of COVID on healthcare sector. The sector is expected to witness short-term operating losses to the tune of Rs 14,000 to 24,000 crore for a quarter. For the hospital sector, which is already constrained with liquidity, onset of such losses will cause cash balances to be completely depleted within a month. Given the capital-intensive nature of the sector, interest coverage ratio, which is already low at 2, will get further constrained to -6 to 9. The revenue for the sector in financial year 21 is also expected to be lower by 20% to 35%, compared to financial year 20, resulting in early single-digit or negative EBITDA for the full year, with annual ROCE is estimated at -5% to -15%. Private healthcare providers and laboratories are currently facing a triple burden unlike other sectors, which makes its situation unique. The industry was already in a very fragile state in the pre-COVID state in terms of its financial robustness. Median return on capital employed of 7%, which is lower than cost of capital of 14%, early double-digit operating margins and median profit after tax margin of 3%. The sector was also operating on cash balance of only 19 days to sustain expenses. Given the capital-intensive nature of the industry, the interest coverage ratio also stands at only 2. Extraordinary drop in demand impacting cash flow, resulting in difficulties in managing payrolls and fixed costs. The private healthcare sector has witnessed an 80% fall in patient visits and test volumes and revenue drop of 50% to 70% in end March. Occupancy levels have fallen to a mere 30% to 40% by late March in relation to pre-COVID occupancy levels of 65% to 70%. Which is expected to further exacerbate with the lockdown in April. no or very limited latitude to reduce fixed cost and perhaps accommodate increase in costs in context of infection control and need for personal protection equipments. While bed utilization is low, private hospitals are expected to be proactive and prepared to manage any eventuality emerging from this epidemic situation. Hence, opportunity to rationalize fixed costs is very limited unlike other industry sectors. Increase in costs owing to infection control and PPE also needs to be accommodated. While the private sector stands fully committed to partner with the government as a national duty, it truly finds itself in a compelling situation to beseech the government for differential, financial forbearance measures and to be supported well, in order to best utilize its capabilities and capacity to serve the nation in this hour of crisis. Recommendations for providing urgent financial stimulus for the sector. Liquidity infusion, short-term interest-free or concessional interest loans to address the operating losses expected for the quarter and immediate 100% release of dues locked with central and state government authorities. Indirect tax reliefs or exemptions or waivers like recoup amount equivalent to ineligible GST credits paid on procurements for a stipulated period, customs duty or GST exemption on essential medicines, consumables and devices for treatment of COVID patients, waiver or reduction of health cess on medical devices, extension of time under the EPCG scheme, etc. Income tax benefits and deferment of statutory liability payments without interest, penalty for a stipulated period, 3 to 6 months. Rebate on commercial rate of power for a stipulated period. Will private healthcare providers benefit? While the private healthcare sector is fully prepared for every eventuality, it is also a reality that, unlike other sectors, the sector is facing a twin burden: A. Investing additional manpower, equipment, consumables and other resources to ensure 100% preparedness for safety in the hospital, and eventual treatment of patients, if needed. B. Experiencing a sharp drop in OP footfalls, elective surgeries and international patients. The industry has been witnessing loss of business and this trend is expected to continue for the foreseeable future, at least 3 to 6 months, and the fact that the sector's costs are predominantly, around 80%, fixed, it is expected that there will be losses and severe impact on cash flows. It is likely that whenever the government announces any fiscal stimulus, this industry will be looked at favorably. The industry is also likely to benefit from increased awareness about healthcare and the more government focus that this endemic is likely to result in. How healthcare sector can navigate COVID-19 storm. A liquidity infusion of rupees 16,000 to 22,000 crore will be required by the healthcare sector, says Vishal Bali. In September 2019, the Global Preparedness Monitoring Board commissioned by the World Health Organization and the World Bank published a report calling for better preparedness by the International Monetary Fund fallout of the high impact respiratory pathogen will contract the global GDP by 3% with which could cost the global economy $3 trillion and 70 nations. The IMF has also predicted that the impact of the coronavirus will leave India with a 1.9% GDP growth, and a longer lockdown can also take India into a potential recession. Around 8 million people who work in the informal workforce of the country will struggle for their basic necessities. The amount of government spending required to combat the impact of COVID-19 on the country is pegged at $79 billion to $130 billion or 3% to 5% of GDP.